Cormack and McCann's framework has become an essential and globally adopted practice in healthcare systems. The framework embodies the nursing strategies, prerequisites, and care environment required to achieve purposeful and therapeutic relationships between healthcare workers and their patients. In this presentation, we will be focusing primarily on the petals. However, it's important to remember that without the surrounding macro context, prerequisites, and care environment successfully achieved, the following approaches cannot be fulfilled. The underlying value of the framework is respect and empowerment, mutual respect in a therapeutic relationship, and respect for the individual's right to determine and excel their health journey and recovery.
So, what is person-centered care? Person-centered care means caring for our patients beyond their diseases or illnesses. Everyone has their own definitions of health and illness, and their own views on what's best for them. Hence, we have to adapt our care and adopt a multidisciplinary approach to meet the preferences, needs, and expectations of each patient. We can utilize appropriate communication strategies, build rapport, educate, and involve family to empower active participation in making decisions about their own health and treatment. By doing so, our patients' dignity and autonomy are promoted. Has their unique set of beliefs and values, influenced by a range of factors such as religion, education, culture, socioeconomic status, and etc. A person-centered assessment is the key to obtain information that constructs an individual's unique life story. It is a continuous and ongoing process as their beliefs and values may change over time. Honoring patient values and beliefs into their daily care facilitates meaningful and personalized care. This in turn promotes self-determination. However, before you can do so, you need to identify your own beliefs and values first. How are you going to be more aware and sensitive to the impact of your beliefs and values on your professional practice? And what can you do when there are discrepancies with your patients? This is where critical self-reflection may assist you.
Engagement refers to the nurse-patient relationship being authentically connected in order to achieve a dynamic and engaged person-centered approach. In these instances, the patient and the nurse are able to collaborate and communicate effectively and truthfully, providing individualized care while upholding patient needs, values, and beliefs. Without authentic engagement between patients and healthcare workers, the level of care provided may be superficial and often undirected. As nurses and health professionals, our goal is to advocate for the health and well-being of our patients and provide person-directed care. To achieve this, the initial step is building authentic and therapeutic rapport. According to Dr. Tim Moore, all effective relationships have 10 common features, including atonement, respect, responsiveness, clear communication, empowerment, emotional openness, and more. Engagement refers
Decision-making is a collaborative process where the best evidence, clinical expertise, and patients' beliefs, values, and preferences consolidate. The aim is to formulate a decision that best serves the patient's well-being, deriving from negotiation and power sharing between health professionals and the person receiving care. Therefore, a therapeutic relationship with respect, honesty, and trust is fundamental. Madsen and Fraser, 2015, recommended a practical guide to shared decision-making that consists of 5 stages: agenda setting, identifying activation levels and the expertise of the patient, providing information about the risk and benefits of each option to enable informed consent, supporting them to establish SMART goals, assessing their confidence in achieving the goals, and exploring how they will obtain assistance to achieve the goals. Skills such as listening and questioning techniques, deliberation, and non-directive guiding must be utilized through these stages to reinforce shared decision-making.
The ability to provide emotional and mental security via nursing practice enables patients to express and address their concerns and feel validated without fear of judgment or rejection. Patients dealing with life crisis or the uncertainty of their future are often seeking emotional security initially rather than superficial interactions stating their medical options and treatments. Adopting an active and empathetic listening style, valuing patient concerns, expressing compassion, and giving time are key factors in achieving sympathetic presence. A lack of sympathetic presence will interfere with initiating trust and building an effective and therapeutic relationship with your patient. Therefore, it is a key factor in holistic person-centered care approach as it develops an open and safe environment for patients to express their concerns on a personal level.
Lastly, providing holistic care. The definition of health adopted by the person-centered care framework is broad. This indicates that the patient's physiological, psychological, social-cultural, and developmental needs must all be considered for nursing care. In other words, the care is for the whole person, not merely for the patient or a diagnosis. Altogether, the 5 elements of person-centered process enhance good care experience, involvement in care, healing of well-being, and existence of a healthful culture, the outcomes of person-centered care.
According to Couzes and Pose's Leadership Challenge model, the 5 elements are modeling the way, inspiring a shared vision, challenging the process, enable others to act, and encouraging the heart. So how does this relate to person-centered care? Well, being a nurse isn't just about bandaging an ouch. It's about advocating for the rights of your patient and, in a sense, being a leader in the work environment. Whether you have a full patient load or are in charge of a whole ward, we are collaborative leaders. One of the core skills of being an exemplary leader and working in a dynamic and collaborative health team is good communication skills and interpersonal skills with your patients and colleagues. A lack of these essential skills creates barriers in all aspects of your care. Poor social skills and communication skills increase the risk of poor productivity, conflict, and stress.
Working under a healthcare organization that focuses on financial and productivity targets, the nurse leaders may be forced to work with insufficient resources, high workloads, and time constraints. The incongruity between their priorities and the management's can increase their level of frustrations, psychological stress, and moral distress. Under these conditions, the nurse leaders would have limited time and low mentality to model the way and enables others to act. These result in nurses feeling burnt out, low staff morale, high staff turnover, and staff shortage, leading to task-centered communication, problem-based interventions, and discontinuity in care, which creates challenges for building positive therapeutic relationships and conducting comprehensive, holistic assessment understanding of the patient, the essential elements of person-centered care. With no organizational support for person-centered care, the nurse leaders could only do so much in a constrained environment. For decades, the biomedical model of health has been the predominant approach implemented by healthcare professionals in their practices. It is disease-centered, task-oriented, and dependent on the use of technologies and medications. The traditional healthcare system also gives priority to the health professionals' advices rather than patients' opinions. This imbalance in power between the two sides leads to a paternalistic health professionals-patients relationship, which is detrimental to the practice of person-centered care. Clearly, the elements shared decision-making and providing holistic care are compromised. Since this traditional style of care is entrenched in the healthcare system, it can be difficult to change. Therefore, the nurse leaders must challenge the process, model the way, inspire a shared vision, and enable others to act. With inconsistency in interpretations of person-centered care across health professionals, many nurses falsely believe that they were delivering person-centered care, while in fact they were delivering care in a task-based manner. Professionals' attitudes such as lack of interest and commitment were also a barrier to PCC. Nurses' strong beliefs, values, and assumptions may also influence their attitudes in delivering PCC. To be able to maintain PCC, nurses need to remind themselves not to allow their feelings to impact the quality of care they provided. They should also actively listen to their patients without judgment to deliver impartial and individualized care with compassion and sensitivity. In order to overcome these barriers and ensure the team provide PCC in an accurate way, nurse leaders are required to enable others to act, inspire a shared vision, and encouraging the heart.
The Planetree mission, founded by Angelica Thera in 1978, is a globally accepted movement to create and promote a holistic, person-centered environment in healthcare facilities. Thera established 10 philosophical components that aim to enhance and embody patient-centered care processes. These include communication through human touch, family, friends, and social support, information and education, health communities, people caring for people, food as therapy, overall well-being, architectural and interior design, spirituality, and arts and entertaining. Metro South Health has become the first in Australia recognised and awarded to be a Plaintree person-centred organisation. This means that MSH facilities are committed to providing exceptional person-centred care to their clients and families, as well as excel in providing holistic care beyond just their clinical symptoms.